question is the connection between genetics and cancer, and that is, if my mother had breast cancer, will I get breast cancer? If my father had prostate cancer, will I get prostate cancer? Or my father had prostate cancer and my uncle had colon cancer, and my great aunt had brain cancer, so their cancer runs in my family, so therefore am I more likely to get cancer? And the answer is absolutely no. The genetic connection between genes and cancer is probably less than 1% if we were able to figure it out. I'll give you some information regarding that. About 100 years ago, 0.5% of the population had cancer. Today, 1 out of 2 men and 1 out of about 2.7 women get cancer. So if it were genetic, it should be that every one of our grandparents had it. But in fact, it's the opposite. So if we understand that, now the one connection that seems to be giving people the justification to think that cancer is genetic are the Bracha genes. And if anyone's had breast cancer or ovarian cancer, they've probably heard of that. It's BRCA1 and 2. These genes, in fact, what we are seeing is that the daughters of women who have had breast cancer with the Bracha genes positive, their daughters at 18 years old will get a bilateral prophylactic mastectomies, because they're so sure they're going to get cancer. Now, the Bracha genes are quite prevalent in the Ashkenazi Jews, and we see a high prevalence of breast cancer as well. And so the conclusions drawn are that these genes therefore cause cancer. We also find, if we look a little deeper, that there's a high prevalence in certain South American groups of Bracha genes and almost no breast cancer. How do we conclude then that the Bracha genes cause cancer? What we have to understand is that whether or not you look at this from a spiritual perspective, that we were created by God, or you look at this from a scientific perspective, that we evolved, in either case, God would not have said, I think I'll give them a few cancer genes, let's have a little fun and watch what happens, see what they do with it. And if you look at it from an evolutionary standpoint, it would not be an evolutionary sound thing to pass on cancer genes. So, I mean, people with cancer would be less likely to mate eventually over time, and we would not see these genes passed on. So it's not that we have cancer genes. What we have to understand is every gene that's in the human genome has certain functions, and these genes are turned on and off by environmental influences, and that's called epigenetics, and that's the environment in which a cell finds itself. Okay, so the cell will respond according to its environment, and that's where we come in. We teach you how to change that environment so that the cells are responding optimally and doing exactly what they need to do. Liver cells are doing liver stuff, heart cells are doing heart stuff, breast cells are doing breast stuff, and they're not needing to do all this other stuff that we call cancer. Okay, so genes can be turned on and off. Anyway, I hope that puts to rest anybody's concerns about genes or genetics and cancer.